cannabis, marijuana, mull, ganja, yandi, weed, bud, skunk, herb, hydro, bush, smoko, pot or chuff. It's known by many names and has been used for centuries around the world for its effects both as a drug and in the production of hemp fibre. Today in Australia, cannabis is the most used illicit drug, with 35% of the population over 14 having at least tried it sometime in their life, and about 10% having used it in the last year. Cannabis comes in three main psychoactive forms. The most common is the dried leaves and flowers of the plant, which are referred to as leaf, heads or bud. The second is hash, which is the dried resin of the bud that is rolled into a small dark coloured block that most often is hard and dry, can be more potent in its effect. The third is oil, which is made by a process of extraction that results in a dark, thick liquid. Cannabis can be smoked in a joint, through a water pipe or a bong, or mixed into butter and cooked and eaten. It's common for people to create a mix with cannabis and tobacco to help it go further and burn better. This can add to the harm for a person by increasing their use of tobacco on top of the marijuana, and also increase the risk of nicotine dependence, which can make it harder to stop. When smoked, the active ingredient that actually gets you high, tetrahydrocannabinol, or THC, is absorbed directly into the bloodstream through the walls of the lungs, and the effect is almost immediate. When eaten, the effects can take up to 60 minutes to kick in, as it must be digested before entering the bloodstream. So don't load up on cookies because you think nothing's happening. It takes time. The effects of smoking cannabis vary considerably from person to person. Things that influence the experience include someone's mood, their personality, and experience in life and drug taking. Also contributing is the amount taken, what else it may be combined with, and the environment that it happens in. Some short-term effects may include laughter, relaxation, inhibition, or enhanced sensory perceptions. Things sound, feel, and taste a whole lot better. But it's also common for some folk to experience anxiety and mild paranoia, confusion, loss of memory, or a lack of motivation, not being able to get off the couch or get the chores done. Long-term ongoing use can lead to increased risk of cancer and damage to the brain and cardiovascular system. It's no good for the sperm count either if you're planning on having a family. Everyone who smokes is at risk of mental health concerns, such as depression, anxiety, or a mixture of psychotic type symptoms. However, some people in particular are at greater risk, as cannabis increases the likelihood of psychotic illness in people who already have a genetic disposition towards a certain condition. If there are mental health issues in your family, then you need to be especially careful and strongly consider leaving it alone entirely. In the short term, maybe it's just not for you. Using cannabis to come down off other drugs, or mixing it with alcohol or prescription medication, can be highly unpredictable and sometimes leads to nausea, vomiting, panic or paranoia. Cannabis is not a soft drug and can definitely cause dependence. Yes, there are people that use it recreationally and truck along fine, but there are also people who experience extreme harm from its use and find that giving it up is not such an easy thing to do. Ever hear stories about how pot is different now than it was back in the 60s and 70s? Well, it is. The commercial drive to get people as stoned as possible has led to a small increase in THC. But more importantly, other cannabinoids in grass, such as CBD, that actually made people feel happy, high and relaxed, have been purposely bred out as growers chase higher profits by tipping the balance too much towards the THC content. Instead of getting creative, we get depressed. Instead of getting relaxed, we get anxious. Instead of getting high, we get low. Cannabis can definitely affect people's ability to work safely. It can lead to a lack of focus and concentration on the job at hand, which then increases the risk of something going wrong. A person may feel like they're not doing anything to harm anyone else, but if they're drug affected, it's easy not to be switched on to what's going on around them, or how their actions may be affecting others, once again increasing the risks of harms. Much like a hangover from alcohol, a night before smoke can leave a person a step behind the play the next morning by impairing their ability to react and think straight while the cannabis takes its time to clear their system. In regards to workplace drug testing, cannabis is the substance most easily and commonly detected. It's stored in the fatty tissue and slowly release back into the bloodstream. If you have a smoke once in a blue moon, it will pass in a couple of days. But if you're a more regular smoker, it can hang around for 2 to 6 weeks in a urine sample. An oral saliva test may only go back 48 or 72 hours, but there's no exact science. The best way to ensure a clean test is to not use it all. If you have any questions or would like support for any drug or alcohol issue, then go to notatwork.com.au to find someone you can talk to in your area.